Hi there, I'm going to be performing a patient assessment here on a patient named Gonzo, and hopefully you can see him okay, and so I'm going to do that now. So what I have is, I arrive, I've got my BSI, and I'm checking to see if the scene is safe. I don't see any mechanism of injury or nature of injury at this time. I have one patient, and I'm by myself, so I'm going to be asking for additional resources. I'm going to consider C-spine. I'm going to be placing a collar on Gonzo until a spinal injury can be ruled out by a physician. My general impression is an 84-year-old male Muppet. He is lying on his back. No immediate clues have been observed. I'm going to introduce myself. Hi there, I'm Tracy. I'm with LTC. I am an EMT student. Can you hear me? Hello? I'm going to go through the AVPU. Or the Glasgow Coma Scale if he was a stroke, suspected to be a stroke patient. Next, if the patient's alert, I'll ask him what his chief complaint is. Hey, what's going on? Why did you call us? Or why did someone call for you? I'm going to check his airway. I'm going to do a head tilt, chin lift. See if I'm placing my hand on his chest and listening. See if I can feel his chest rise. See if I can hear his air going in and out. And I can. Make sure that airway's patent. Breathing, I want to make sure his breathing is adequate. What's the depth? What's the quality? Again, if not breathing, I would take a treatment timeout and we would make sure that he was breathing at that time. Circulation would be next. If there's bleeding, I'm going to control that bleeding by applying direct pressure or tourniquet if needed. What is his pulse? I'm going to be taking his radial pulse or his pulse at his carotid artery. What is the rate and what is the strength of that pulse? So now it's decision time. Is the patient crashing? Would it be a load and go? Is it time sensitive, such as a stroke or heart attack, or where you would promptly transport them? Or is it a patient that's fairly stable, you can stay and complete a secondary assessment? You'd want to expose the patient as needed, but you still want to maintain their body heat. So on Gonzo, we could take his sweater and check the extremities and so forth. A fast exam at this point, if they're unresponsive, do they have a significant mechanism of injury? You do a fast head to toe exam. You want to do a cranial or a head to toe. You're going to start at the head, palpate. Do I feel anything in the neck? Do I feel anything in his upper extremities, the sides, his ribs, his hips? Do I feel anything down his legs, his feet? Nothing. Okay, then what I would want to do at this point, I want to get his vitals. And so I would start with taking his blood. Then I'm going to put the pulse oximeter on, find out what his oxygen stats are. Then I'm going to take his radial pulse. And then I'm going to check his skin. What's his skin like? Is it cool, clammy? What's going on with that? I would be taking his blood pressure. Then I'm going to be listening. I'm going to auscultate his lung sounds and see what I can hear. What am I hearing? Am I hearing striders? Am I hearing crepitation? Am I hearing cracklings? What's going on with his breathing? Are they equal, bilateral? Then at that point, I am going to put the EKG on. We're going to run an EKG, see what his heart's doing. Then we're going to come up and we're going to assess the AVPU. We're going to look into his pupils. What are his pupils doing? Are they dilated? Are they equal, reactive? We're going to, it's a big end tidal. Sorry, Gonzo. Check his end tidal, breathing out of the nasal cavity. What is he doing there? What's that like? We're going to check his temperature, and that would be his vitals at that point. We want to do a history, an OPQRST sample. The O would be the onset, P provocation, Q would be your quality, R radiation as severity, and T would be the time of event. Maybe when did someone see him? When did they call? Signs and symptoms. A sign is going to be something, his arm's missing. That's a big sign. Allergies. Do they have medications? What would be his pertinent last medical history, if he had anything? Yes, I've done this before. I've passed out, so forth. What was his last oral intake? Simply meaning, when was the last time he had something to eat? And what were the events leading up to him calling or someone else calling 911? You want to use follow-up questions as you go along, like an investigator. You're going to say, well, have you ever had this happen to you before? And what happened? And is this like that? Is this similar? Is the pain similar? You want to do an in-depth physical exam at this time. You want to do a full body exam. And then you want to get your jump bag, and you're going to use that, the medications that we're able to administer, such as aspirin, oxygen, EpiPen. If this was an anaphylaxis, we would be applying that obviously to the thigh. And if he's having chest pains, the nitro. You want to keep assessing every 5 minutes for an unstable patient and every 15 minutes for a stable patient. You obviously are going to put them on a backboard or on a gurney, and you're going to transport them to a medical facility as soon as possible.